The eye is the jewel of the body, so said Henry David Thoreau. A Fresno ophthalmologist understands that and is traveling the globe to restore and preserve them. His story in tonight's To Your Health.
He's been to Honduras, Nepal, Afghanistan.
Here's Madagascar on the map.
And last week, Fresno ophthalmologist Dr. Ghajar went to Madagascar, an island nation east of Africa in the Indian Ocean. He went to restore something many of us take for granted, eyesight.
There are a lot of people with reversible blindness from corneal diseases that can have their vision restored with a cornea transplant.
Corneal transplant is not currently available in Madagascar, but Dr. Ghajar, along with the Lions Club Sight First program, offered it free to 6 people there, 3 men and 3 women, some blind from disease or injury and pre-screened by local doctors.
They were mostly young people in their 20s up to the ages of 40 who had lost one eye. Now, a couple of them were legally blind in both eyes, and so we still only did one eye because it is such an involved surgery.
The corneas were donated by an eye bank in the U.S. Dr. Ghajar kept them on ice for his 20-hour flight.
This is a young man who had also keratoconus, and he was 20 years old.
These are pictures the doctor brought back of the 6 surgeries in 2 days, quite a contrast to the 1 or 2 a week he normally performs.
The instrumentation and the microscope were not ideal, and so the surgeries took a little bit longer, and I wanted to make sure that they have excellent, outcome. So each of them probably took about an hour and a half to 2 hours each.
Grueling, yes, but the end result was worth it.
The younger patients who had actually very immediate results, they were very happy. I didn't understand their language, but they were just very thankful, and same with their families.
Dr. Ghajar also conducted 2 lectures during his stay to instruct the ophthalmologists in Madagascar on the aftercare for these patients. He says it's his hope that one day the doctors on the island nation will be able to perform corneal transplants themselves.
For a glasses or contact lens wearer, LASIK surgery may seem like the right option, but technology has advanced and there are more options to correct your vision. Dr. Ghajar is here from Eye Medical Center to expand on all that. Welcome to the show, Doctor. It's good to have you here again.
Thank you.
What is advanced surface ablation? Because that's one of the newest technologies out there, isn't there?
Yes, Alex, it's an improvement actually on predecessor to LASIK, and it's similar to LASIK. It allows correction of your vision with getting rid of glasses or contacts, but without the flap that's used in LASIK.
Okay, so is this for maybe someone that needs LASIK, or are there certain candidates? Who are good candidates for this then?
Well, candidates who, people that do not qualify for LASIK sometimes are those with very high nearsightedness or people with thin corneas or severe dry eyes. And advanced surface ablation allows these people to basically have their vision corrected without the risk associated with LASIK.
No kidding. Well,
Yes.
that's great news for those people, because I know LASIK is an amazing thing for many people. What makes this different than LASIK then? I know you touched on it a little bit, but
the technique is different. There is no flap, and so we're just touching the superficial aspect of the cornea and reshaping it with a laser. And previously it was associated with a lot of pain, and sometimes the outcomes were not so great, but with new techniques and use of a contact lens after the surgery just for a short period of time, there is no pain, and it's the outcomes are fantastic. Sometimes they're better than LASIK.
no kidding. Wow. Okay, another option. It's called, and correct me if I say this incorrectly, intraocular lenses.
Correct. Intraocular lenses are exactly what they sound like. They're lenses that are put inside the eye. Now, when people have cataract surgery, they have lenses placed on inside their eye, but for young people who do not have cataracts and you just want to correct their vision, and what you can do if they're very nearsighted and they're not good candidates for LASIK, then we have 2 options right now. One is an intraocular contact lens, and the other one is an intraocular lens that goes in front of the pupil, and that's for people with very thick glasses. We can provide this option to them.
At what age?
It can be done basically over the age of 21 or to the age when somebody's vision has stabilized, where their glasses are not changing anymore.
Okay, but you say wait a little while, because obviously a child's eye just develops and develops.
Sure,
so,
your
okay.
prescription's changing.
Gotcha.
So here you see a picture of what's called the Visian lens. It goes behind the iris, And then there's another one called the Verisize lens, which goes in front of the iris. And they're both good options. This is the one that goes in front of the iris. And this is a little bit more surgically difficult to place, but in my opinion, it's a safer lens than the previous one, and so I really prefer this technique.
Okay, and I know more pictures are going to pop up. Go ahead and describe to us what we're looking at, because I think it's really interesting that there's so many options out there.
Correct. This is the Verisize lens, and it goes in front of the pupil and the iris, and it clips onto the iris. And if you're -15, -20, you can have this lens basically make you independent of contact lenses.
No kidding.
It's a wonderful option because not only does it make you independent of glasses, but the visual quality is a lot better than, let's say, somebody who's wearing very thick glasses.
Do you feel it?
No, you don't feel it at all because it's on the inside of the eye. So we don't really have sensation there unless there's something bad going on.
Okay.
So this has really no feeling. It's always comfortable.
And you obviously can't even see it.
Yes, you can't see it. If you look, you know, at a normal distance, maybe if you look under a microscope, you'd see it. But at a normal distance, you won't be able to tell that somebody has it in.
And it's permanent.
It's permanent, but in some ways it's removable, which also makes it a safer option compared to LASIK, because LASIK, when you reshape the cornea, it's reshaped forever, but this can be removed.
Because a lot of times with LASIK, I've heard people complain about their night vision not so good anymore.
Correct.
Is that the case maybe with this, or is that?
Very rarely, if people have large pupils, they may have some glare and halos, but another advantage to this is that because you're not touching the cornea, they're not going to have dry eye symptoms, which is another issue with LASIK.
Yeah. Well, it's great to have all those options out there.
Yes,
Pretty soon,
it's
do you think
fantastic.
people are just not going to be wearing contacts or glasses anymore?
I think pretty soon we will probably have treatments for everybody with whatever prescription that they could be independent. You know, obviously the safety is the most important matter here, and these are time-proven techniques now.
That's amazing. 486-5000. That's the number for Dr. Ghajar. He is over at the Eye Medical Center of Fresno. We sure appreciate you being here.
Thank you very much.
Come back and keep us posted on all those new technologies out there.
Thanks,
would you?
Alex.
Okay, thank you, doctor. Stick around. Central Valley Today. We'll be right back.